Officer in Charge, Chief Medical Officer, Dr. Leonora Febrea-Drago, our Communication Officer, Ms. Shina Harry, members of the media, ladies and gentlemen, good morning. Our latest epidemiological data reveals significant progress across the three concurrent health challenges, while highlighting the critical areas requiring sustained vigilance. The gastroenteritis outbreak continues its downward trajectory with a 246% reduction in cases since the March 5th peak. Rotavirus remains the predominant pathogen, detected in 89% of confirmed cases. The outbreak has disproportionately affected Roseau Health District, which accounts for 888 of the 1,537 total cases island-wide. Children aged 1 to 14 years remain the most vulnerable group, representing 57.5% of total cases and 81% of 91 hospitalizations. Although we have seen no fatalities and a median recovery time of just 3.2 days, new cases remain above the epidemic threshold. Our influenza surveillance now confirms cases have fallen below epidemic thresholds, a significant achievement since the post-carnival surge peaked on March 15. This progress follows targeted public health measures implemented during the outbreak. To date, we have recorded 281 cases, with influenza B responsible for 70% of confirmed infection. We are observing an unusual pattern. Cases cluster in two age groups: young adults aged 25 to 44 years at 23.5%, and school children aged 5 to 14 at 21.1%. Most importantly, our containment strategies are proving effective. Just 13 hospitalizations occurred, with no severe outcomes reported. We are closely monitoring emerging leptospirosis cases, with 10 suspected patients hospitalized in March. Samples were sent to CARFA for PCR testing, and laboratory results have confirmed 2 positive cases, including 1 fatal outcome. The deceased patient sought medical care at a late stage of infection and died from multi-organ failure, a severe complication of leptospirosis. Given diagnostic challenges, early symptoms like fever, headache, and muscle pain mimic common illnesses, and testing delays can hinder timely confirmation. We are taking proactive measures. 1, providing immediate empirical antibiotic treatment for suspected cases to prevent severe outcomes. 2, distributing updated clinical guidelines to healthcare workers to aid early recognition. And 3, educating high-risk groups on avoiding exposure to stagnant rainwater, rodent habitats, and contaminated soil. Physicians should maintain a high index of suspicion, particularly for patients with exposure history, recent heavy rainfall, and clinical signs like conjunctival suffusion or severe cough pain. These alerts also serve as a critical public reminder to avoid high-risk exposures. To protect our communities and maintain the progress we have made, everyone must continue practicing these critical health measures. Wash hands thoroughly with soap and water, especially after using the toilet, before eating, excuse me, and after contact with potential contaminated surfaces. Follow proper sanitation practices, including safe disposal of human waste and regular disinfection of high-touch areas in home and public spaces. Use oral rehydration salt as the first sign of diarrhea to prevent dehydration, and cover coughs and sneezes to limit the spread of respiratory illnesses. For farmers, construction workers, and others who work outdoor, additional precautions are essential. Wear protective gear, waterproof boots and gloves when working in areas with stagnant or contaminated water. Store food securely in sealed containers to prevent rodent access. Seek medical care immediately if you develop fever, muscle pain, or eye redness after exposure to floodwaters, soil, or outdoor work environments. By working together, staying vigilant with hygiene, supporting high-risk workers, and reporting symptoms early, we can keep our communities safe and healthy. Thank you.
Thank you so much, Dr. Ahmed. And of course, just a few key takeaways from his report. There has been a marked decrease in the number of cases of both gastroenteritis and influenza, and there have been some confirmed cases of leptospirosis. However, we continue to ask that we remain vigilant, and especially in the case of leptospirosis, early intervention is necessary. If you suspect that you have come in contact with that bacteria, please seek early medical intervention. At this point, we invite to the podium the officer in charge in the Office of the Chief Medical Officer, Dr. Lenora Favrier-Drygo.
Everyone, good morning to Dr. Ahmed, our national epidemiologist, senior administrator Raymond, our communication specialist, Ms. Sheena Harry, media colleagues, and everyone listening and viewing in the public. So, as promised last week, we're here again to give you an update on this gastroenteritis and flu outbreak. Thank you for joining us today. And please allow me to reiterate some of the positive developments regarding this recent outbreak. Despite the ongoing health challenges, we have observed a significant decline in cases of gastroenteritis and seasonal flu in the past week. This is encouraging news, and I want to take this opportunity to discuss contributing factors, what it means for public health, and the steps we must take to continue moving forward. So the contributing factors to this decline are as follows: increased public awareness. Our public health campaigns and media coverage have reinforced preventative measures. Social distancing and masking, measures introduced for other outbreaks and this outbreak as well. Control has been limited, and the spread of other infectious diseases, especially at our healthcare facilities. I have personally witnessed more mask wearing in business places and offices. We have changes in social behavior. More people are staying home when unwell, which reduces transmission in workplaces, in schools, and in public areas. What does this mean for public health? The decrease in these illnesses is a positive outcome amid this ongoing outbreak. It demonstrates that preventative health measures are effective and should be encouraged beyond this current situation. Hospitals and healthcare providers can now redirect our resources to medical needs. Etiquette: cover your mouth necessary. And if experiencing prolonged or severe symptoms, please consult healthcare providers to prevent complications. Your local health district team is always available. And in conclusion, while we have challenges ahead, the decline in gastroenteritis and flu is a testament to the effectiveness of our collective efforts. We encourage everyone to stay vigilant and continue practicing these preventative measures to ensure long-term health benefits. I thank you. Now we will take any questions from the media.
Yes, good morning. You mentioned one of the factors that has contributed to the fall in the number of cases would be social distancing. Could you explain that factor for us, please, in terms of social distancing?
So social distancing has happened inadvertently in that we are now in the Lenten season, so we have less to use a colloquial term, less fetting happening. So we have less mass gathering, and therefore we have seen a decrease because less persons are socializing within this Lenten season. So the Lenten season is actually working in our favor in this regard.
What happens after the Lent? Would you continue to ask people social distance after
Well, like I said, one of the recommendations is that we continue practicing proper sanitary and hygienic methods. So if you're going out in public or you have plans to go out in public and you know that you have flu-like symptoms, the responsible thing to do as an adult, as a citizen, is to stay home or stay away. And if you do have to attend such an event, you wear a mask. So that would prevent the spread. But the onus is on us as citizens to take responsibility for our health and make sure we make the right decisions to protect everyone around us, not just ourselves.
You also said that the mask, you've seen a lot more people using the mask in the various workplaces. Is that really a fact?
It is a fact. I have been to a few offices and seen people wearing masks, and even at the ministry you'd see people wearing their masks. Unfortunately, sometimes those masks are one below the chin, and I would have to say your mask is supposed to cover your nose and your mouth. But I have seen a few more people wearing masks, and that means that they're listening to us and they're following instructions. If you feel well enough to go to work, that doesn't mean you have to go sneezing and coughing in public. So you're well enough physically to go to work, protect your environment, protect your work colleagues. Supervisors should also encourage that masks be worn, because what will happen eventually is that more and more persons would be missing work because they are affected. So the onus, like I said, the responsibilities of every citizen. So you as an individual, you protect yourself, but then you think, in my office, we're in a closed space with air condition, and if I go in and I'm sick and I have the flu and I don't wear a mask, everybody else around me is going to get sick. What may happen? My supervisor may now say, oh, Jane is not at work. Can you do this amount of work that she's supposed to do today? So it falls on us, really and truly, to make the responsible choices. And supervisors understand. You have the flu, you cannot come in. Then you send in a sick leave, you visit the health center, and you make sure that you're properly medicated and take care of yourself and each other.
Last week Friday at the press conference, I think that you all mentioned that with Outbreak, we had the Outbreak at the time. Do we still, one can say a week later, we have this Outbreak, is it still going on? Is it, or you have reversed that trend?
So Dr. Ahmed is going to come and give you the figures again. And last week we also explained what the epidemic threshold was. So he can again, for clarity, because we don't want to say every time there's a rise in something that there's an outbreak. So our national epidemiologist is going to answer that.
Thank you for the question. Yes, actually, our protocol, according to our protocol, the outbreak will be over once we observe and trend below the threshold in 2 consecutive weeks. Until that point, the outbreak alert will remain. That the outbreak is over, then the point that current trend went below the epidemic threshold will be considered the point was the end of outbreak. But nonetheless, observation continues until next 2 weeks to confirm that outbreak is over. And that it applies at this time. We only have the respiratory flu outbreak is below the epidemic threshold, whereas gastro is still above the epidemic threshold. Nonetheless, we mentioned that trend is downward.
While you're at the mic, Dr. Ahmed, I just want to find out a little about leptospirosis. You gave some figures. Did you confirm that one person has died?
Yes, there was one death.
And what then would be your message to the public? Are we at a crisis level right now? Because I think you said that one or two people are also hospitalized because of leptospirosis.
Yes, once a case is suspected, we administer the empirical and immediate administration of antibiotic for leptospirosis, suspected cases. We actually collect the sample and then do the test. That's after treatment being administered. So my message to the people, those who are, as I mentioned in my speech, if you are in contact with the risk factors that I mentioned, then, and you develop some symptoms, including those what I mentioned, then please seek immediate medical attention. So the earlier you come to or seek the medical care, it is better for you and better for the physician to really administer the medication on time.
I can't remember if last year, 2024, we mentioned leptospirosis at all. But can you compare what happened last year with what is going on right now in 2025?
Correct. Actually, there were no cases in 2024. The last time we had leptospirosis, it was way back in during Hurricane Maria. Actually, afterward Hurricane Maria. That's when we had confirmed cases of leptospirosis. We did have some suspected cases, but that turned out to be negative afterward. This is the first time we are seeing so many suspected cases, 10 suspected cases within a month period. So this is something that we are investigating. As I mentioned, all 10 samples, the result for samples came back, and they were all negative except two cases.
Dr. Ahmed, are you concerned, or should we be concerned now with what we are seeing?
No, these are still sporadic cases. They are not cluster, they are not outbreak. These are still sporadic cases. The cases are coming from all different areas of Dominica. And there, nothing should be concerned about as long as you seek the medical care on time. This is very important point for the general public, that seek medical care as early as possible. Not wait until you cannot urinate, not wait until your eyes looking yellow, not wait until if there any organ failure. Please come early so that we can assess the situation and see what stage you are in. As I mentioned, we administer empirical antibiotics, which is we do not wait for the laboratory confirmation to start the medication.
Yeah, but doctor, we have a culture in Dominica where generally people don't go to the health facilities unless they are very, very ill. How does one know that he has leptospirosis?
Actually, this is difficult even for physician to really distinguish from leptospirosis from other illnesses. It's going to be difficult for the general public, but the unlike any other diseases like influenza and dengue, your risk factor involves where you work, if your activities involved in outdoor, if your activities involved with stagnant or contaminated water possible. As I mentioned, the professionals that include farmers, construction workers, as well as those who are involved in recreational activities outdoor, they should be much more concerned about if you happen to develop signs and symptoms following an outdoor activities. This is the point that you need to come to the hospital, and please make sure to tell the doctor that I developed these symptoms once I came from the river, bathing from river, or just an example, or I was cleaning my backyard, something to that nature.
Thank you.
All right, thank you very much. And if there are no further questions from the media, I'd just like to thank everyone for joining us this morning. Thank you to our presenters, Dr. Ahmed and Dr. Drygo, our media partners. We thank you all, as always, for helping us disseminate the information. And of course, our listening and viewing public, we remind you it's always important to remain vigilant. If we want to keep seeing a decline in our numbers, vigilance is key. Thank you again, everyone.